If you're looking for ways to stimulate neuroplasticity, it's important to first understand what allows brain healing and repair to happen in the first place. Whether you're dealing with a brain injury or a chronic neurological condition, the question isn't just, is neuroplasticity possible, but what does it actually take to stimulate and support neuroplasticity, to really encourage brain healing and brain repair? That is what we're going to cover in today's video. If you're new to this channel, I'm Dr. Jason Saunders, founder of HBOT USA. I've been in this industry for over 20 years, and we've treated numerous patients with a variety of different neurological issues, from developmental delays to brain injuries and TBI and concussion, all the way through neurodegenerative disease. And while we typically don't use hyperbaric alone, hyperbaric oxygen therapy has always been a foundational component to any protocol that we're developing for patients with a variety of different neurological conditions. While hyperbaric oxygen should not be looked at as a treatment or a cure for any of these neurological conditions, it does play a foundational role in so many of the pathways necessary to stimulate neuroplasticity, to really initiating brain healing and brain recovery. In today's video, we're going to be talking about what neuroplasticity actually is, why it doesn't just happen automatically on its own, and what role hyperbaric oxygen may play in supporting a variety of these different conditions, allowing the brain and the nervous system to adapt and to recover. So let's talk about what neuroplasticity is. Your brain is essentially your body's CPU. It's the computer processor for your body, and it relies heavily on its ability to interpret signals from the outside environment and then relay them to all the different responses that the body may have internally. Your health of your nervous system, the health of your brain, is directly related to the health of all of those connections, all of those wires that are tasked with sending and receiving messages to understand the stimuli and to create appropriate responses. Those connections are called synapses, and neuroplasticity is all about building, developing, and establishing new connections, new synapses for better, more specific, and more targeted communication between the brain and the body, and from the body back to the brain. Just as I mentioned that the health of your brain is directly related to the health of your synapses, the quality of your life is directly tied to those connections as well. Your ability to understand your environment and your ability to adapt and respond appropriately to environmental signals, by definition, will dictate the quality of your life and your ability to participate in life's activities. While your brain is receiving and sending hundreds of millions of signals every second, there are a number of different factors that can interfere with the receiving and sending of those signals, changing the body's interpretation and/or changing the body's responses. From chronic inflammation and chronic toxicity to tissue damage or trauma, or even subacute infections, can all create interference with all of those connections and messages that are going back and forth. And when we have those issues, especially chronically, this leads to dysfunction and ultimately to disease. Improving the neuroplasticity or the adaptability of our brain and building those connections is paramount for the central nervous system to recover and to promote long-term function in these systems. For most of modern science, there was an assumption that the central nervous system was not capable of healing, that any damage that was done to the brain or the spinal cord was damaged forever, and that the central nervous system is incapable of healing. With more recent research and more recent clinical experience, we now see that that's not true, that the central nervous system is capable of healing. It is capable of repair, and it is capable of regeneration. There are also two distinct categories that might cause these interferences inside the central nervous system. One could be neuron dormancy versus neuron death, or tissue damage and cell death. But both would result in very similar consequences, a disruption of the signal receiving or the signal transmission. Inside the conversation around neuron dormancy, almost all of that can be recovered. This is a downregulation of function that requires certain nutrients and certain stimulation to bring that function back. If the tissue is either damaged or dead, now we need to actually regenerate and heal that tissue or mobilize central nervous system stem cells into that area for tissue repair and regeneration. And in both cases, this is really where hyperbaric oxygen shines, particularly from neurological healing and recovery. The brain, while it makes up only about 2% of our body mass, uses over 20% of all the oxygen that we bring in every minute of every day. The brain is highly metabolically active. It requires enormous amounts of oxygen and energy just for normal function, let alone an additional amount of energy for healing, recovery, and regeneration. Low oxygen environments will very quickly disrupt the quality and the quantity of cellular signaling exchange. In fact, almost every chronic illness you can think of has hypoxia or low oxygen environments being a foundational hallmark of that disease. Restoring normal oxygen levels is a foundational component to almost every neurological condition that we can talk about. Hyperbaric oxygen therapy increases the oxygen available throughout the entire body. These higher oxygen levels can support cellular energy production, and in many cases, this may actually help to wake up or stimulate these dormant cells and these dormant tissues. And even in the cases of tissue damage, that oxygen could be used for cellular repair and for tissue repair, or even for mobilizing these new stem cells into the area to remove damaged or dead cells, remove senescent cells, and help migrate in these new naive cells that will take over and stimulate a healing response locally in that area. Hyperbaric oxygen therapy is often discussed as a way to support the environment that's needed for neuroplasticity to take place. We need to be very clear here. Neuroplasticity is a process. It's a journey. It's not an event. It takes time. These changes do not happen all at once. It requires consistency, and this is weeks, months, and years, not days, hours, and weeks. Commitment to a program over a period of time is really the only way we can achieve meaningful levels of neuroplasticity. And the amount of time needed really varies based on the severity of the issue and or the chronicity of the issue. How long has somebody been suffering, and how bad is the injury, or how lofty is the goal? Obviously, with increased severity or increased chronicity, it will take a longer period of time to get the healing results that we're looking for. If we get to something less severe or more acute in the earlier stages of the injury, then we can expect to have a much faster response from a neuroplastic standpoint. Catching an acute mild concussion right away and starting a process of healing would be a much shorter healing than, let's say, a massive TBI with loss of consciousness that happened 4 years ago. A TIA, a transient ischemic attack, caught early and dealt with quickly would be a much shorter course of care than a serious stroke. Catching a birth injury after days, weeks, or even a few months of the birth and intervening with meaningful strategies, including something like hyperbaric oxygen, would have a much faster impact than, let's say, waiting until the child is 4, 5, or 6 years old before attempting the variety of therapies that could stimulate neuroplasticity. That's not to say that the chronic and severe TBI or the massive stroke or the birth injury addressed much later wouldn't improve. In fact, we see neuroplasticity and neuroplastic changes in some of the worst cases that you could imagine. It's just that the sooner we get to neurological injury, the faster and more significant the responses tend to be. As I mentioned earlier, hyperbaric oxygen is foundational in almost all the neurological repair, recovery, and regeneration cases that I can think of. At the same time, it's almost never used in isolation. There are a range of other therapies to consider, from other dietary changes to supplements or other therapies such as red light therapy or neurofeedback. As we all know, when we combine meaningful therapies and we get synergy from that combination, the result is always more meaningful than any one of those therapies done on its own in isolation. There are some limitations to how far some of these neuroplastic changes may take us. Again, based on severity, based on chronicity, based on synergy of multiple modalities simultaneously, based on the individual and how their body responds to the different therapies and treatments that they try. 20 patients with the same diagnosis will likely have 20 different results. In many cases, when we first undergo these therapies, we're not sure what the total recovery will look like in the end of these protocols. Oftentimes, there will be moments of faster progress, followed by moments of slowing down or even plateauing. Those are the signs of the body healing and then catching up, healing and then catching up. And it's important to recognize and honor those differences between different patients going through similar protocols. The key to neuroplastic change is consistency over time. You will not see instantaneous improvements. You will see slow, gradual changes over long periods of time. And we always have to look back and remember where we started from. It's very common to get frustrated as you're going through a program of neuroplastic change and brain recovery. But looking back where you started from and recognizing this slow transition over time helps us understand where we actually are in the progress of that treatment and should also help set a standard for what to expect in the coming months. So neuroplastic change is absolutely possible. Brain healing, brain recovery is absolutely possible. But complex systems like the nervous system and complex issues like brain conditions require multi-therapeutic approaches over long periods of time. In almost every case that I can think of, this is not the type of issue that you should be going after on your own. I think it's really important that you find people in this space that you can trust, that can help you build a meaningful protocol, cut through the noise of what won't be helpful in your particular situation, combine the components that will most likely be meaningful for you, and really build that multi-therapeutic approach together, monitored over time, adjust as necessary, helping you work towards whichever results and outcomes you're hoping for. We've done a range of videos from a protocol standpoint, from neurodegenerative disease to concussion to TBI with PTSD, autoimmune diseases. So if you're looking for more detailed recommendations from a protocol standpoint, cruise through the HBOT USA channel. I'm sure you'll find a video that explains more detail for your specific indication or use of hyperbaric oxygen. Hopefully this video on neuroplasticity helps you. You understand what it is, what it takes to start to make those changes, what role hyperbaric oxygen plays in the neuroplastic changes and the healing and recovery of the central nervous system. And I appreciate your time and attention, and I'll see you on the next video. Maybe you just bought your first chamber, or you're thinking about buying your first chamber. Maybe that's a home use chamber, or perhaps you're considering offering hyperbaric inside your clinic. And if you're anything like me when I first started, you're realizing how much information there is out there, and you're concerned, are you doing this the right way? Are you being safe? How am I going to utilize this hyperbaric chamber in the most effective way possible? If you're just getting involved in hyperbarics and you're looking for an introductory training program, the basic hyperbaric technician program is exactly what you need. In this course, we're going to cover how does hyperbaric work? Why does hyperbaric work? What makes hyperbaric oxygen such a unique therapy? What mechanisms of action are taking place? What are the benefits of hyperbaric, both short and long term? And what types of indications are appropriate to utilize hyperbaric for? We will also help build your confidence, not only in how to utilize the therapy, but how to talk about this therapy with patients or with other healthcare providers that may not understand hyperbarics the way you will once you finish this course. So if you're ready to dive in, click the link below this video and let's get started.